Language Development Among Children with Communicative Disorders by Heather Maxey. Risk factors involved with communicative disorders is going to be reoccurring ear infections, children who know very few words or do not talk at all, children who have problems interacting and communicating with you. 10% of elementary students have a communicative disorder. Communicative disorders will be identified by the age of 3, and during preschool screenings is when your child will be diagnosed if you have not already previously before school got them tested or known signs of communicative disorder. Types of communicative disorders I'm going to be talking about is going to be hearing difficulties, articulation disorder, fluency disorder, specific language impairment, cognitive impairment, and autism. Hearing difficulties. There's 3 different types. The first one I'm going to talk about is conductive hearing loss. That involves the middle ear. Transmission of the sound vibrations is disrupted. That means when you hear something, it's going to vibrate through your ear, and if that vibration is disrupted, you are not hearing. You're not hearing correctly or what all you should be hearing. Chronic ear infections can be a cause of why you have lost hearing. Sensorineural hearing loss involves the inner ear, and that connects the nerves, or that's a connection with the nerves, which means that the sound is not being transmitted to the brain. Congenital hearing loss, that is present at birth, so whenever you have your baby and they take them back for all their screenings, at that time your baby will fail the hearing test. And most of the time, if your baby fails the screening test at birth, it is because of genetics, and about half of all permanent hearing is inherited. Hearing difficulties, behaviors. So behaviors that you may notice inside the classroom is you're going, if the child does not respond when you say their name, you want to pay attention and see if the child responds only whenever you're close to them or when you're talking face to face to them, like if they're watching you talk. You want to know if the child is paying attention to you, so like if they can follow directions without having to ask you several times to repeat the directions or the next steps. And then another sign is like if a child acknowledges what you're saying and then a few minutes later they're doing something totally opposite. That's a big sign that they did not hear you and they do not know what they're supposed to be doing. Does the child misunderstand or ignore what you're saying? So like if you're saying something, maybe they're just not doing it at all, or they are off doing something else, so maybe they didn't understand what you're saying correctly, or they just didn't hear you at all. These are going to be a few things that you can do as a teacher to enhance language development for the child inside your classroom. When speaking to the child, you want to get close and down on their level and speak to them while looking at them so that you know they can hear you, they know they can see you. During group activities such as like circle time or morning meetings, maybe place the child close to you so you know that they can hear, or up by the board so they can watch the video, songs, and they can hear greatly. Maybe use gestures with directions or to get the child's attention in noisy activities. If there isn't a specific gesture for that, then you can make your own inside your classroom. You can put a picture board up and say, you know, this means everyone get my attention, or, you know, like just different gestures you can make inside your classroom that can mean like, oh, let's clean up, or let's get ready to leave, just different things like that that you can incorporate in your classroom for children with hearing impairment. You can give the child opportunity to listen to our story with headphones, read a book with headphones. That option just gives them the opportunity to be able to turn the volume up so they can hear better and more understand the story or whatever activity you are doing. Maybe whenever you're speaking, use a moderate volume. So that way you're not talking too low, too high, like the same volume all the way across. That way they can hear and understand what you're saying. Whenever you're talking to the children in your classroom, maybe tell them to talk to each other closely or face to face without singling out the child with a hearing impairment, just so that way they are able to hear and interact with their peers correctly. You need to allow an appropriate response time for the child to answer a question so they can process what is said and then respond to you. Their response time may be longer than another child or your own response. The next disorder I'm going to talk to you about is articulation disorder, and that is indicated when a child's speech at age 3 cannot be understood by anyone unfamiliar with the child. That is anyone that's not their parent, their mother, their father, siblings, anything like that. And that means that they do have a problem if they're not being understood by other people. If at age 8, errors in articulation are still present, so that means they're 8, they're probably first, second grade, and if you're still not able to understand most of the words that they are saying, then that's another big sign that articulation disorder may be the reason why. The causes could be chronic ear infection, cleft lip, cleft palate, or tongue tie. And that is because ear infections can damage the middle ear to where they can't hear correctly. Cleft lip, cleft palate, and tongue tie, that can all three of those can make it to where the child cannot speak correctly or be able to pronounce certain sounds because of that problem if it hasn't been corrected. How the teacher can enhance language development. You need to create a positive classroom. You need to make them feel welcome um, and just comfortable, not judged or anything like that for their disorder. You need to encourage students to communicate with each other and not to embarrass the struggling child. If they're struggling with sounds, you do not need to point it out, correct them, anything like that. That's going to cause embarrassment and point out the fact that they are not doing it correctly, even though they are trying. Problems with communication is dealt with in a caring, sensitive manner. So you don't want to be mean or make them feel self-conscious. You want to be caring and sensitive to that manner as you are talking to them. You want to make sure no one is teasing or making fun of the child struggling. So you want to monitor all children and make sure that no child is singling them out, making fun of them, calling them names, or anything like that. And the teacher should work closely with the child with their specific needs. So if the child is struggling with certain sounds or words at certain times, the teacher could do some one-on-one time to work specifically on the problems for that child. Fluency disorder. There are two different types of fluency disorder. It's disfluency, which is stuttering, and stuttering is a repetition of isolated sounds or syllables and prolonged speech sounds. Linguistic disfluency, that's interruptions or repetitive speech. Stuttering is the most common type. These are going to be ways that the teacher can enhance language development for children who stutter. Make sure the child is in speech therapy and sees them regularly. That is the first thing you'll do as a teacher. At the beginning of the year, you will make sure all your children that have IEPs and have different therapies are on schedule to meet with their therapist and get that extra help that they need. The teacher can implement specific techniques in the classroom. That's going to include you like talking slower, waiting for the student to respond, look at the student and listen, and encourage turn taking. When you talk slower, it's going to give them time to process what you're saying and understand it. And waiting for them to respond is going to be sure that you're not rushing them. If you're going to rush them, that's going to make them anxious and they're going to stutter more. You don't want to put them inside of any situation that's going to cause high anxiety or stress on them, because that's going to make their stuttering worse, and you want them to be calm and confident in what they're going to say back to you. Teachers should communicate with the student in a way that reduces conversational demand on the student. Like I said, you don't want it to feel pressure. You don't want them to feel pressure. So you want to talk to them in a way that it comes natural to them and they don't have any added stress on what they're saying. Some students may need reassurance and acceptance from the teacher and their peers. Yes, you don't want to make them feel singled out or that they are different. You don't want the students especially to be teasing them, making fun of the way that they talk. You want to make sure that they are accepted and reassured that what they're saying is okay, like they did good, they're doing a good job. Teachers need to ask the child questions they can answer in a few words. If you are talking to a child that stutters, if you give them an opportunity to answer inside the simplest way, that's going to prevent less stuttering for them and make it easier for them to respond to you. You want to monitor social interaction to ensure no teasing is happening. Yes, you want to make sure that no one in your classroom is making fun of or teasing the child with the disorder. Call on the child with the disorder early in discussion. If you call on them early in the discussion, that stops the anticipation of them knowing that they're going to be called at some point, and that's going to build anxiety and stress on them, knowing that they're going to have to answer something and cause their stuttering to be worse. So if you do it early on, then they have not built up that anxiety and stress in the conversation. You also want to encourage children to read in pairs so that way they can learn to read with other people and to kind of lower that stress level. It's just them and another student one-on-one. They need to practice turn taking and being patient with each other. Specific language impairment, SLI. SLI is a term used to refer to children whose language development is substantially below age level and there is no identified cause. Significantly delayed language development. This is whenever a child's language development is way behind their age. They have a normal range of hearing. Their intelligence is at their age level. They have no development disability. So there's really nothing wrong with them other than they are not able to communicate and say and talk as they should for their age group. They have difficulties in receptive and expressive language. So they're not able to even express what they want to say either. They have limitations in all 5 aspects of language knowledge. And they also have difficulties maintaining conversations and understanding what you are saying to them. And you're probably going to have trouble understanding what they are saying to you as well. Ways a teacher can enhance language development. You want to have a positive environment that focuses on interactive communication. So inside your classroom, you always want to make sure you have a positive environment, that the student is comfortable, but you want to focus and improve that interaction communication. So you want them to communicate with their peers, communicate with you. You want that to be a key component inside your planning. You want to make conversation child-centered. That means you want the child to start the conversation. You don't want to lead the conversation. You don't want to push. You should listen actively and then just kind of respond with open-ended questions. So the child has time to respond to you. You don't want to just end your question. You want to ask a question with a question. You can also do storybook sharing one-on-one with the students so that you kind of know where they're at and what they're understanding from the story. You also want to encourage them whenever they're interacting with like the pictures on the book or what is happening in the book. You really want to build on that so that way they can practice their communication skills with you. And if you use verbal mapping and linguistic scaffolding, that's going to help them tremendously throughout the year inside your classroom. Cognitive impairment. Cognitive impairment can be caused for a number of reasons. This can be a genetic factor like Down syndrome. It can also be caused from a brain injury, like from a car accident or something like that, or it can be from the child getting lack of oxygen during birth. Um, they may not process language effectively, difficulty paying attention, they are going to have trouble processing speech and remembering what is said. How to teach to enhance language development. You want to focus on the child's linguistic level in planning learning activities. You don't want to focus on their age because they're probably not going to be at the same level as their age. So you want to give them activities and learning materials based on their linguistic level. Um, they also do better whenever you use repeated experiences. Like if you use the same book over and over again, that gives them time to learn the information. Repetitiveness is key. So that way, if they relearn the same thing over and over again, it's going to finally stick. Um, you're going to want to monitor the child to see how well they're doing and take notes on their progress. And you're going to encourage them to ask questions or for help. So if they're struggling, you don't want them to struggle. You want them to know that you are there for them and you're there to help them no matter what it is. Autism. Autism is a spectrum disorder. Each child may be affected differently. Um, autism is a wide spectrum. Usually no two children are going to be the same, just depending on which side of the spectrum they are. There are so many different there's so many different qualities of this disorder. Like no two are going to be the same. It's a complex neurological disorder that affects communication and other aspects of development as well. Boys are 5 times more likely to have autism than girls. Diagnosis usually made between 18 months and 4 years old. Early signs of autism. Early signs of autism is eye contact and shared reference. They're usually not going to share eye contact and they're not going to um, share reference the same thing as you. So if you're looking at something, they're not going to share that with you. They're usually not going to play with you or interact with you as much as other children will. They're going to have repetitive play patterns such as lining things up. They play with cars. Instead of playing with cars, like rolling them around, they're going to line them up in a row. Um, they may use different patterns such as like colors, smallest to biggest. They may only want to play with things that are all the exact same. It's just depends on what they prefer. Behaviors. Behavior is initiated through gestures, pointing, or sounds. So they may not actually talk with you, but they may grab your hand and lead you to the door if they want to leave. They may point to their lunchbox if they are hungry. Um, they probably will not respond to their name or look at you, even though they do hear you and they do know their name. When you say their name, they're probably not going to look at you as if you had just said it. Um, an early sign is no babbling, pointing by 12 months, no single words by 16 months, no two words phrases by 24 months. Some children can have language and then lose it kind of early on. And a lot of autism kids are nonverbal for a very long time or forever. How to teach to enhance language development. The first thing you're going to do if you have a child with autism inside your classroom is you're going to want to get an IEP plan wrote up for their individual needs. They're going to need a plan based on their own goals, based on their own level of what they are on. And then after you get an IEP, you're going to plan for that child based on their needs, and that's how you're going to implement that into your classroom. Special interaction activities and communication. those are going to be on their special within their needs as well. So you can, if the child is nonverbal, then you're going to have to get some kind of communication inside your classroom, whether that be sign language, picture charts. Um, you can also have like a picture ring that you have on your like lanyard. It's gonna have different pictures of like the classroom, the lunchroom, the playground, their lunchbox, cafeteria, bathroom, stuff like that. So you can use that when you are communicating with them. You'll be like, do you need to go to the bathroom? And you'll show the picture of the bathroom. Or are you hungry? And you'll show them the picture of their lunchbox. Ways like that. That's how you are going to interact with them inside your classroom. You also want to make sure that they are set up for all their therapies that they will need, whether that be speech therapy, OT, PT, all those. You're going to want to do some one-on-one time to work with the child. That can be, depending on the age group, if you're going to do pre-K, that can be hand in hand to help them write. You can do math with blocks. You can do spelling with letters if they're nonverbal, just different things specific to their need. A big thing that I would suggest inside your classroom is to have a calm down corner, unless your school has a sensory room. A calm down corner is going to be a safe place for them to go whenever they are overwhelmed and they cannot calm down. You're going to want to go to the calm down corner to give them that time and space that they need to calm down, because they are overstimulated, or they get overstimulated a lot with different things. That can be with too many people, loud noises, different things like that. So they're going to need a safe, quiet place where they can sit down and calm down until they are ready to come back and learn again. If you have a sensory room, that is a great thing to have. So they can go to the sensory room for a little bit to calm down and then come back to the classroom to participate with other students. The social interaction with other kids is what's very needed, because they're not very social or know how to interact with other kids. So they really need that involvement with the other children to succeed.